morning, Guildford Health Centre. How can I help?
You had this sort of tightening of the foreskin. Can you retract it back to go for a wee or anything like that?
Not at all.
See, I'd say they look like bites.
Any idea from what?
You know, where do we go as a family to try and get him the help and support he needs?
Are you normally generally fit and well?
No, I'm bulimic.
Does that hurt there?
Yes.
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing something.
I actually found her in the hallway of the house. She was still alive, but only just, and she died 3 hours later in hospital.
Good morning, Guildford Health Centre. Sally speaking.
John Ferguson, please. Hello. Hello there. Come and have a seat.
Right, good morning to you.
Good morning.
On Saturday, I went to the loo and had to strain to produce any stools, as it were. And when I got up, I noticed there was quite a lot of blood in the bowl of the loo. But since then, my stools have been quite loose and I've been able to go to the loo normally. And there's no blood in the bowl, but when I touch it with the toilet tissue, there's still a witness of blood. My ex-wife has been a nurse for 40-odd years, so I phoned her up and she said, well, that sounds like a hemorrhoid.
Any history of any bowel problems in the family at all?
No, not at all.
Pop yourself on the bed. I want to feel... I'm going to feel your belly and then I'm going to feel in your bum.
Guildford Health Centre, Sally speaking. Yeah, what's your date of birth, please? 14th of March, 1974. And what's your name, sir? Oh, sorry, I'm giving you 20 years there. That's not very good, is it? God, 43, that wouldn't put you out. That's not very good, is it? Exactly.
I'm Dr. Graham. I think we have met before.
Yes.
Yeah?
Got
How
the
can
same
I help?
first name. Well, in a playful way, my cat whacked my eye,
Right.
and it's been really painful.
You're a bit swollen up all over your cheek, really, aren't you?
Yeah, like here, here,
Yeah.
oh, there.
OK. Is it getting worse?
Yeah.
Yeah. OK. Do you feel...
Like,
yeah.
it's sort of puffing up into my vision, so...
Yeah.
Let me just have a feel here.
Oh,
Yeah. You a bit swollen there.
yeah.
OK. All right, let's just look at the eye area. OK. Close your eye. OK. I think what's happened is that when you were scratched, it's maybe if some bugs have got in under the skin and it's a little bit infected. So that is called a cellulitis, OK? So I think we should give you a short course of antibiotics. And you're not allergic to anything as far as you know?
No.
No.
Why is there a picture of Henry VIII in here?
Good question.
Because he's a bit of a bastard, really. Isn't he?
That picture was done by Holbein, but it was copied by my great-aunt. So I know who the artist was. She has died since then.
He was like, I'm going to kill loads of women.
There you go. OK, Anna?
Thank you very much, Anna.
Pleasure. Bye-bye.
Bye.
Big breath in. Point your bum at me and then draw your knees up. The key is to try and remain as relaxed as you possibly can. And the way to do that, I always say to patients, they laugh, but the way to do that is to open your mouth and breathe gently in and out through your mouth. This shouldn't hurt. Relax. And just... No, keep, that's right, that's right. No, I can't feel anything I missed there. Just stay there. You can pop this, when you're ready, get your breath back and then get yourself dressed. Sit yourself down. So what this is all about, I have to tell you,
Okay.
is the possibility that this might be a cancer being there, not anything else. And the figure that they've chosen is if you go on bleeding for over several weeks.
All right, well, no, it stopped. Now I've been able to go to the loo and it's not bleeding at all. So.
Well, that's very good. So, yes, I agree with your sister.
My ex-wife.
Your ex-wife. Sorry.
No, don't worry.
So that's likely to be a hemorrhoid inside that's bleeding a little bit. If you get a bit of bleeding after you've done the poo.
No.
After you've defecated, and then you're wiping yourself as you see blood on the paper, that's very likely to be a hemorrhoid.
Okay, well, that's what's happening. Right.
Otherwise, I couldn't find anything abnormal at all.
Okay, good.
So I'm sure the right thing is to wait and see.
Okay.
How are you?
I'm so.
You've had lots of contact with your psychiatrist, haven't you? And I've had some with Vicky and...
I want to talk about that first of all. Hello, they had internal meetings, which I wasn't part of. I'm frustrated that they just don't seem to listen to me. Nobody is addressing the issues of what keeps me in the traumatic circle. Trauma, and you know, it's me trying to grab things that are there, like the sanctuary, like women's groups, things like that, and try and focus on moving forward. But my symptoms, my trauma, my flashbacks, my nightmares, my insecurities, my depression, my anxieties, this has not gone away.
So you've just got the 2 spots now, have you? And nothing else?
Yeah, this one's only small.
Tibanus has got a rash on his right leg. My arm has got, like, real bad.
Right, OK.
So, concern is, it was a mole and now it's changed.
So an itchy patch?
Yeah.
Yeah. Oh, yes, just here.
Yeah.
Yeah.
Come on through, Jeffrey. So we had a chat about this yesterday.
Yes.
Saw you in November, December, when you had this sort of tightening of the foreskin.
That's right.
But you could get it back, and I referred and it got rejected.
Correct.
But since that time, it's got worse.
Definitely.
And what can you do? Can you retract it back to go for
Not
a
at
wee
all.
or anything like
Not
that?
at all. There's no retraction at all.
Mm-hmm.
And it's getting a little bit embarrassing because obviously there's no direction.
So does your wee come out
Yeah,
does it spray at
yeah.
all or?
Yeah.
Okay. Okay. And is there any skin change on the tip of the penis that you can see?
There's colour change.
There's a colour change.
Yeah.
And when did that develop?
Well, it's been developing since it hasn't been able to retract.
Yeah. Yeah. Okay.
Hi, Glenn, it's Rose. Hello, I don't know what I've done, but my screen has completely turned around.
Let me just try and see what they're trying to do about it. Say that you feel down persecuted. So many different services, it's difficult to keep track of who does what and what you can expect. They also think that your expectations of services may be unrealistic.
only expectations I have of services if somebody is offer me something that it actually happens.
Yeah.
Because it's not happen. It's not happen. Okay, now I want to talk a little bit about the gender situation. Okay, I'm going back to Laurel's. Right, I was told last time I brought it, I had to wait 2 years to put the application in for the gender recognition certificate. So it's 2 years come now. But when I have to talk to both my psychiatrist there and you, because to go before the panel, I need my GP and I need the psychiatrist agreement letter. Are you happy to do that?
I think you should talk to the Laurels first and go because they will obviously know much more about that than me. But if they're saying that the situation is right for you, then yes, I will be able to confirm that.
The second thing, I'm in the position to go forward for surgery, for breast surgery, yeah. But the surgeon that I had the consultation with.
But you've had a consultation.
I've had one consultation. Okay. She's now sent me away with 2 things that she'll require from me. You know, I'm working on my weight loss anyway, and I'm consistently working on that. So that's part 1 thing. Good. And obviously the second thing would be my GP to say that they're happy for me to go ahead.
I don't see any problems with this, Valentine. OK? All right? So speak to the Laurels about both those things. OK? So we've got a plan there. All right?
Yeah, OK.
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 All right. OK.
Thank you.
Bye-bye now.
Okay,
bye-bye.
Yeah, bye.
What have they done? It did, it went off like that, and then it... Ah, well done. Thanks, Glenn.
So, sorry, Jeffrey, I just need to... Can you see what you can retract yourself?
Yeah, sure. There's nothing at all.
There's a whitish skin change there, though,
Yeah.
isn't there? Yeah, fine, OK. And let you pop your things on and get dressed. That's OK. I think you've dropped a couple of copper pennies there.
Oh.
Right. Well, obviously it needs sorting out. I think what's going on is something called BXO, which is a kind of skin condition that over time in your sort of age group leads to just the tightening of the foreskin, exactly the kind of symptoms you describe.
Yeah.
And so that needs acting on pretty quickly, actually. Haven't seen a case for a while, actually. BXO stands for balanitis erotica et obliterans, and it causes thickening of the foreskin and depigmentation. This presents with symptoms of poor stream when you're passing urine and pain during intercourse. It's relatively uncommon, we don't see it very often. Medical options are using steroid creams, which sometimes help, but unlikely in cases where they're occurring in older age groups. Usually the definitive treatment is surgery, which is often a circumcision procedure. Does it itch at all?
Every now and again, I get that really it itches inside.
Yeah.
And you can tell it's quite hard skin at the top end.
Try and keep the area dry. The other thing is just to book in for some blood tests. I just want to check your sugar level and a few other bits and pieces, because you haven't never really had any blood tests.
No.
So if you take that along to the treatment room, they'll book you in.
Yes.
I'll speak and sort out the urology referral again.
Yes.
See what we can do, but it's more urgent now.
Yes.
Remind me, do you smoke at all?
No.
You've never smoked?
I gave up when I was 10.
You gave up when you were 10?
Yeah.
Should I ask how old you were when you started?
About 8.
Were you just trying it or smoking proper?
No. My friend and I used to go down to Central Park in Plymouth.
Right.
Because my dad was in the Navy, so there's 60 a day, so there's cigarettes everywhere.
It was
so
freely available.
So we used to just go into the park with a packet of 10 and a bottle of lemonade.
Then muck around.
And then when I was 10, Steve decided to drag one down, and I thought, no, I didn't like that.
Didn't like it, so it put you off for life.
Yeah, definitely.
OK, well, there we go. All right, Jeffrey.
There's not too many people who say that.
No. I'll speak to you a bit later.
Brilliant.
All right, we'll get that sorted ASAP.
Lovely. Thanks very much for that. Brilliant.
Take care.
Thanks a lot.
Bye.
Hello, reception. Hello, all right. Yeah.
Thank you very much.
Yeah.
Thank you, darling. See you later.
Okay, I've added it on for a phone call, but it can be any time between now and when we close. All right. Thank you. Bye.
And what's brought you here today?
So she has, I can only describe it as a rash on the back of her neck.
Okay.
Which is a lot more fierce and flared than any that we've had before.
Right, okay.
But we don't know what they are, and we can't work out why she keeps getting them.
Okay, and has she been well in herself?
She's well in any other aspect.
Right, okay.
Looks that might be our animals, our 2 cats.
You got 2 cats, have you? Okay.
Put them, Bubs.
And do they get regularly treated?
Yeah, this is the thing. At one point, I was getting to the point where I was hoovering mattresses and...
And have you actually treated the house as well?
Yeah, I've sprayed the house.
Let's have a little look at your neck.
Stand up then, sweet. So that's the worst I've ever seen them.
How do you sleep? Are you in a duvet?
Duvet.
And do you have
You wrap yourself up in those little woolen blanket things.
a night dress or
No, she's been sleeping in her vest and underwear.
vest and
recently.
underwear? Okay. See, I'd say they look like bites.
Okay. Any idea from what?
Could be flea bites. That's what it looks like to me.
Because I've literally stripped everything. I pulled everything out of her room and hoovered the lot, sprayed the lot, and then the cats are defleed every 4 to 6 weeks.
The only way we can do it is, again, suggest treating the house and maybe this blanket as well, really.
Is there anything that I can do to make that go down?
Stop it itching, she could take an antihistamine.
OK, well, we've got that at home, so that's all right. Right, we're stripping your bed, we're boiler washing everything, we're spraying the hell out of your room. Everything that lives in your room is dead by the end of it. See, cats, bad idea. Bloody things.
Hello, I'm Dr. Bolam. Right. So, how are you?
I'm good.
Yeah. So tell me what's going on. You weren't living at home, were you?
No.
Is that right? Just tell me a little bit about that.
I used to live in care, and I was with a carer since the age of 8.
Okay.
So then I decided to tell my social worker that I would either run away or you could put me where I want to be. So I ran away from Cornwall and legged it all the way up to Bristol. But I didn't tell my family where I was for like a whole week until
Where were you?
House hopping.
Okay. So what's happening now then? What, social services know where you are.
Yeah, I'm living with Mum at the moment.
Okay. So what can I do for you today?
I have ADHD and I take 80 grams of methylphenidate hydrochloride every day.
Okay.
And sometimes it feels like my emotions get locked away in my head, like no emotion will come out sometimes.
Let me get this straight. Are you here today to discuss this, to potentially change it?
Yeah.
Right. Okay. We need to
Why
think
were
about
you
that.
told to come here though, Leanne?
Because I took an overdose on my meds.
How many did you take?
I took 10 of the 5 milligram ones. So it wasn't like my normal high dosage, but I hadn't had anything for a couple of weeks with my meds.
Okay.
And then I had loads of them.
Okay. Let me get it straight. You've been off it altogether for a couple of weeks?
Yeah.
Because you'd run out?
No, just because I don't...
Just didn't want to take it?
Didn't
so
take
for
it.
like 2 weeks you'd had no methylphenidate at all?
Yeah.
And then you took 10 5 milligram ones?
Yep.
So that was 50 milligrams?
Yep.
And what you told me a minute ago was quite often you take more than 50 milligrams in a day anyway. OK, this needs sort of straightening out, OK? All right. I want to see if I've got a letter from your community paediatrician, OK?
Yep.
So what they write is that you should take 50 in the mornings and then occasionally you take a 5. What they're saying is in the context of you needing to kind of concentrate.
Yeah.
OK, that's what they say. Now, if you're talking about feeling like you've taken too much, maybe that's the solution.
Yeah.
You take 50 in the morning.
Yeah.
And then you just use these if you... I mean, you're not doing homework now.
No.
Maybe you don't take these at the moment.
Yeah.
Do you need some counselling? Are you under thinking aloud? Do you know what thinking aloud is?
Don't know.
Shall I write that down for you?
Yeah.
OK, it's support for all children in care, all right?
Yeah.
But I would think they should be aware of you. They should be aware of all children who are looked after, which is the sort of fancy name for being in care. OK. And you're feeling a bit better now?
Yeah.
Is that all right?
Yeah.
OK. It's nice to meet you. So do you think you're going to be staying in Bristol then?
Hopefully, yes.
OK, good.
Yeah.
Excuse me, there's no phones in here, my sweetheart.
David Parfitt, please. Hello there.
Good afternoon.
Sorry about the wait. Come on
that's
through.
okay.
Come on in, come and take a seat.
Thank you.
I'm Dr. Ahmed. We haven't met before, I don't think.
don't believe we have.
No. How can I help?
Well, here's the thing. My mum died last week.
Oh.
And I've got 50-odd years of stuff to sort out.
Was that an expected death, or...?
No, it was... Well, she was 81 and had been suffering, but, you know, it wasn't really expected. I actually found her in the hallway of the house. She was still alive, but only just, and she died 3 hours later in hospital.
And where are the pains?
So, I mean, it's still like my legs still feel a bit tingly on occasion.
I've got problems with my knees.
Both of them?
Yeah.
I've had sort of on and off pains in my big toe joint.
This knee's been playing up a lot lately.
It's more when I bend over.
Any numbness or tingling?
No, I've just got pain right down to the fingers.
I don't think I've met you before.
No, I'm
Yeah.
William.
Hi.
Hubby, obviously.
OK, so what are we doing today?
I went to the hospital weekend, Monday, wasn't it, with the arthritis.
Woke up with terrible pains in her arm, as
Right.
per usual.
Yeah.
Went to A&E for 7 o'clock. As soon as they opened, we like to get there on time. And the usual thing, I mean, Grace keeps thinking they're going to do something drastic, but,
Yeah.
you know, because once she had a
the knee
morphine
terrible,
injection in the leg.
Yes.
And I think she thinks they're going to do that every time.
Yeah.
So what they did was give her extra strong painkillers.
Oh, yeah.
Oh, yeah.
So
And she asked me that she was letting you know, isn't it? Oh, that's one, isn't it?
Yeah.
Some codeine.
Codeine,
OK.
just to say double strength or something.
So you're affected in lots of bits of your body, aren't you?
Yeah.
Got to learn to slow down. Because as
Which
soon
I
as she
have
has a good day,
Yeah.
she's out in the garden and she'll move and pull
Yeah.
things about.
But I guess you've got to do what you've got to do, haven't you?
Just forget.
Yeah.
Yeah. You're okay
Yeah.
today, you're doing
Yeah.
it, washing big out.
So, show me, with your hand, show me which bits are really sore.
Well, what can I say all round here?
That joint, so
And
that
which?
bottom bit there, yeah?
Yeah, oh yeah.
These bits here.
Yeah. And the other one was the elbow and that.
Right.
Sorry, started
Yeah.
from the elbow and went
Yeah.
right to here, and then all
Yeah.
of a sudden.
I mean, the
tap
most
hand.
likely is that this is the sort of arthritis caused by sort of wear and tear, osteoarthritis. But it is you are
osteo.
quite bulky here, and
I
it
did
is
say
quite
this morning
tender.
to you, didn't I look at that bit?
And your
My
wrist
eyes
is
are going
quite
this way.
swollen, yeah? Does that hurt there?
Yes.
Yeah.
it does.
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing a different sort of arthritis, OK? Which might need a slightly different sort of treatment.
Right.
OK? Grace is thought to have osteoarthritis, but when she came to see me, her wrist seemed a little bit unusual for that condition, in that it was swollen and red and tender. And so I thought I ought to rule out an alternative diagnosis like rheumatoid arthritis. So if you have the bloods done at some point, maybe in a couple of weeks, and then book to see me a week after and we'll discuss the results, I'll give you some of these with paracetamol in, and we'll see how you are. Osteoarthritis is the commonest form of arthritis. It normally affects the large joints, such as knees and hips. Rheumatoid arthritis affects the small joints of the hand as well as larger joints. The main difference between the two arthritises is that rheumatoid arthritis unfortunately destroys the joint. So it's important to make the diagnosis early so that you can be on medication to prevent that from happening.
There we go, that's gone through to next door.
Right,
Okay.
that's super, yes.
All right, there we go. You
We
take
go
that
through
back.
and
Do you want to put that
that's
back in
it.
there?
Yep. Put your hand back.
And that's for you to make an appointment to have the bloods done and see me afterwards. Okay?
Right.
Okay.
Okie dokie,
Excellent.
that's fine.
All right.
Yes.
Yeah, go ahead.
Dr. Bolam.
Bolam?
Is it Bolam?
Dr. Bolam, yeah?
Is it Bolam?
Yes. Is that who you
The
just
lady
seen?
I just saw, yeah.
Let's have a look. What's your date of birth?
16th of July, 1957.
19...
57.
Sorry, 16th of July, 19...
Don't say it loud.
Oh, sorry.
My mum died last week.
I'm sorry.
Yeah.
That's quite a shock for you, isn't it? If you
Yeah, and I kind of...
just popped round to see her,
Well,
presumably, or...
I had a weird feeling. That was the thing. I'd spoken to her the night before, and she was a little bit out of breath. And she was clearly a little bit confused. I don't know. I tried ringing her in the morning, and she didn't answer. That's not unusual, because she's out feeding the birds or shopping, or a very active person. Tried her again after lunch. Didn't answer, and I thought, that's unlike her. And I just had this horrible feeling. I don't know, I can't really explain it. It's just one of those...
Sixth sense.
Yeah. So I went there, and I was so glad I did, because she was still alive, albeit breathing very shallowly, that's such a word. Yeah, she's, you know, unfortunately, she died in resus in casualty.
And have you... what I find is that you... When you're busy with it all, it's OK, and then sometimes after things settle, it hits you what's happened. Because there are moments that you feel absolutely fine because you're busy, then you feel guilty about feeling fine, then you feel sad, then you know, so it's a whole mixture of emotions.
Yeah.
And I think it's a normal pattern.
Yeah, I'm going through the what if sometimes. I think, oh, what if I'd gone round there that night?
Yeah,
She was clearly in trouble, and I didn't pick up on that.
You couldn't have changed anything. We've all got our time, haven't we? We're all here for a limited time. That's the only certainty, actually.
Yeah,
so,
that's very true.
You know, and actually you acted on an instinct there anyway to go around in the first place. So you got that last bit
I was
there.
glad I was with her, let's put it that way.
Yeah, that's right. That's right.
Yeah.
So, I mean, you'll be... The whole sort of bereavement reaction's quite a process, really.
Yeah.
But come and talk to us about it.
OK.
We also advise, I mean, and it's entirely up to you, but you can always contact CRUISE, which is a bereavement counselling service.
Oh, OK, I didn't know that.
I'll give you their phone number. Sometimes it's helpful to talk to an objective person who's not friends or family.
OK, that's brilliant, thank you.
Yeah.
Thank you very much.
That's all right.
Right.
Take care.
OK, thank you. Thanks very much.
Bye-bye.
Bye.
Bye-bye now.
Bye.
Oh, is somebody making coffee?
I don't drink tea or coffee, so...
I don't think that's a terribly good excuse. I don't know how to boil an egg, I never eat them. I don't know how to cook meat, I never eat it. That would be all right, wouldn't it? That would strike a rather high moral tone, that one.
Laura Smith. Hiya. Come in. Have a seat, all right? Right, how can I help you?
OK, so recently, well, over the last month or so, every now and then I get this horrendous pain. Like, I don't know where it is, but it's more like here. And I can't tell whether it's in the front or in my back. And if I'm quite honest, I got a query of what it is, and this is only because my mum said she had it. She thinks it's gallstones. Because my mum had gallstones, and she had to have, when she was my age, and she had to have her gallbladder removed.
Okay.
But I never told her about these pains, and my mum's saying you've got to go and get it looked.
When did this all first start, then?
About a month ago. I would almost say it's constant because I'm getting like a dull ache in between now, between the attacks. I can feel something's hurting me.
So it's happening every day now?
Yeah.
Are you normally generally fit and well?
No, I'm bulimic. Yeah.
Okay.
But I am well, but I've been bulimic for like 10 years. So.
Okay, so what's your diet like at the moment?
I don't binge eat so much, not anymore, but I do throw up every time I eat.
Do you think it's related in any way to having an empty stomach and not having eaten, and then do you think that it's at all relieved by then eating?
Probably.
Probably.
I don't know.
The other thing...
My eating pattern is just so ridiculous. Sometimes I can go 2 or 3 days without eating.
Okay.
And then I can just eat normal, or I might binge eat, or I have no consistency to my diet.
Right, let's have a feel of your tummy then. If you just have a lie down on the couch for me a second. Let's have a feel of your tummy lower down here. And have you been passing urine okay?
Yeah.
No burning, stinging, pain?
No, not that I've noticed.
Any pain there?
I don't like that.
Don't like it, but not painful though?
No. Yeah, that's right. More just uncomfortable.
Okay. Right. Come and have a seat again. So, have you been emptying your bowels okay?
I never do. No, I can't have a bowel movement without using a suppository.
Right, OK. So it does sound like it could be gallstones. The other thing would be something like a stomach ulcer. Have you ever had any acid reflux or a feeling of, like,
I always get that, yeah.
Have you ever told anybody about that?
Well, no, because I always thought that was a bulimic thing. Like, you know, that I just assumed in my head that because I'm eating, throwing up, my stomach's producing acid.
Yeah.
And then I'm throwing up the food, and so I'll have excess acid. So
Which you will do, and that logic makes sense, but the problem is the fact that the acid is then there in an empty stomach, so the acid can be breaking down the lining of your stomach,
Okay.
your stomach ulcer. So start with this, because this could make a difference. If it is a stomach ulcer, this should really help.
Okay.
But what I want you to do before you start taking them is a stool sample. You're not going to be able to do that, are you?
No, it's not going to happen.
The reason being because sometimes there's a bacteria called H. pylori that can live in your gut. Loads and loads of people have it, and quite often it doesn't cause a problem, but it can start to cause you problems with heartburn, indigestion, acid reflux, things like that. So if you manage to
Yes, I will try.
bring that back for us.
I always try, if I'm honest.
And then make an appointment to come back and see Dr. Pelly, and then he'll be able to look at getting a referral to do whatever tests they think they need to do.
OK, I'll give it a go, thank you.
All right. Have a good week.
And you.
See you later.
Bye-bye.
Bye.
Hello.
Hi, come on, Dave.
Hi. Get out.
So I'm Dr. McLaren. It's nice to meet you both.
Yeah.
OK.
I'm here with Evan regarding a bit of a sort of ongoing problem.
OK.
Evan's been on antidepressants, but hasn't been on them for the last sort of 4 weeks. So he's gone back to sort of quite heavily with drinking and smoking.
It's only cannabis.
OK.
I thought, is there any point? OK, I need to be taking the tablets, but if I'm still smoking and I'm still drinking, what's the point of taking the tablets when they're not going to be doing nothing to me? The problems and everything that I had going on seemed like they weren't getting no better.
You know, it's a difficult situation. He's going away today.
Okay.
I'm going to go and stay with my brother for a week to get him away from Bristol. But we wanted to see if there could be, you know, I don't know if it's counselling, a drug programme. You know, there needs to be something.
Yeah. You've mentioned drugs and alcohol earlier on. Tell me what's going on at the moment there.
When I feel low, I'll turn to the drink, have like a couple of cans, and then where I've had a couple of cans, that makes me feel happier in myself.
How much do you think you drink?
Only 4 to 5 cans. It's not like I won't binge into like spirits and all that. Like, it's just
lager.
Lager, like.
Okay. And drugs as well. So
it's only cannabis. I'm only a cannabis user. I've never touched no other
But you've
drugs.
been like that since about 18.
16.
Sort of 17, 18. You know, even though as a family, we still support him and try to do what we can. We don't know where to go with it anymore. You know, where do we go as a family to try and get him the help and support he needs?
you been in the wars?
I fell down the stairs.
Oh dear.
Yesterday I was cycling, and then 26-ton of lorry come in. I was in this blind point office. I was on my side.
oh gosh.
I'm running down the escalator and I just tripped and fell.
And in the end, he sort of hit me really bad. Then I just pushed me off my bike.
Yeah.
My bike just got crushed.
Yeah. Because I broke my ankle bone down there, and I also damaged my knee.
What it is, my hand.
Yeah, what did you do?
I literally fell on it really hard.
My ligament of my little finger went.
Yeah. And have you injured anything else?
Mainly my muscles, my neck, and my shoulder.
Yeah.
I think I've done something to my back.
Right, OK.
I twisted my back on Monday because I work up the hospital.
OK.
And I had an old lady, and I tried to make her roll on her own, and she didn't.
OK.
So in the end, I sort of ended up pulling the sheet out from under her.
Yeah,
And as I went like that, my back...
Right, don't do it again.
No, no.
OK, all right.
And over the past couple of months, I've been getting shooting pains down my back and in my leg, and it's sciatica.
OK.
But it goes, then it comes back.
OK. Has that changed at all?
No.
No. So this is something different that you did?
Yeah, it was just on, like I said, on Monday, I was like up and I was rolling this lady from this side of the bed. And I went like that, pushed her, and I was holding her up, and as I was holding her up, I could feel me like pain in my back.
Sounds very much like you've just sort of strained a muscle in your back, doesn't it?
Thank you.
OK?
Yeah,
Let's just have a... yes. I'll just have a little look, OK, just to make sure it's not anything else. So it's all on this, slightly on this left side?
It's on this side. It's always on
okay.
my left side that the pain is.
OK, all right. And it's turned around here, is it?
Yes.
OK, all right. I mean, you just need to be really careful lifting patients and stuff, don't you?
Oh, yes.
Okay.
Oh, I know that.
Right, OK. I mean, what's going on about your sciatica?
It's my age anyway, isn't it? That's what I'm told. And I'm overweight.
Yes, that won't be helping.
No, when my doctor's left and he said, you're very obese.
OK, that was a polite way of putting it, wasn't it?
And he said, you have to do something about it.
OK, all right. So are you doing it?
I'm trying, but
it's just
now
talk.
I'm retired,
It is hard.
I'm starving. All the time. I mean, I'm continuously, not being funny,
I thought you weren't retired, you're working at the hospital.
Yeah, I work only part-time.
Oh, I see, OK.
But,
have you got weight? Are you doing Weight Watchers or anything like that?
No, because see, I have depression, anxiety, and panic attacks, and I'm having major panic attacks again. They've started up again really badly.
I just wonder whether I should refer you to Weight Watchers or anything. Would you like
I went up to the gym once, and
once doesn't
no, I had a
usually
panic
work.
attack, major panic attack. But if I get the hang of it, I would like to go again to the gym.
Would you like me to send you back to the gym?
Yes, please.
All right.
And I will go.
OK. All right.
The thing is, I think because you're depressed, you eat, and because you eat, you're overweight. It's a vicious circle.
It's a vicious circle. Absolutely.
And I've now got into it that I can't get out.
Yeah. No, that's right.
But I look at people going to the gym and I think I'd love to go. I really would.
OK. All right. Well, brilliant. Let's see if
and
we
I will
can,
go this time.
Good. OK. Let me just.
I've got my tracksuit bottom ready.
Oh! You are just going to be on it, aren't you?
Oh yeah.
Good morning. Can I help?
Hi, my daughter, she's got conjunctivitis. She needs to see the doctor.
I can take your daughter's date of birth, please.
It's the 13th of January, 2011.
13th of January.
14. Why am I messing it up?
So, what do you think we should do?
Give me some sort of help.
OK. Did you have any particular type of help that you thought would be useful?
I don't know. It's hard because I find if I'm active and I'm doing stuff, it takes everything away off my mind.
So what happened with Rhodes? Have you got their contact number?
Have I got a contact number
for Rhodes? In terms of support, because it looks like you're looking for a bit of support, they actually quite like the call to come from you.
Yeah.
Because I guess
instead of them coming to me.
Yeah, well, instead of me saying, you have to go and see them, it shows that that's something you want to do. If you take
off my own back.
ownership. Yeah, exactly.
Another thing as well, whilst I'm here, is I've run out of my antidepressant tablets.
Yeah. What do you think we should do? Because it sounds like you weren't that keen to take them. Do you want to try them again?
It's not the antidepressants. It was more of the diazepam that was keeping me happier and more bubblier in a person.
Diazepam, I'm quite reluctant to prescribe. The reasons being are it's very addictive, and I guess you've showed that you've had some difficulty with impulse control and with substances anyway. So I feel like I wouldn't be doing you any favours by giving you more diazepam.
Yeah.
But we could think about a different antidepressant to see if that has more of an effect if you wanted to.
I feel like the antidepressants that I was on weren't actually doing nothing.
Okay. Well, let's try something called sertraline. You've not had that one before?
No.
Okay, if I give you a couple of weeks' worth, and then when you come back, you
make an appointment to see a doctor or whatever, yeah.
Yeah. I think it's good that you've come in. I think that we do need to make some changes. Some of them will come from getting the right support, and some of them are things that you know...
I need to do myself, yeah.
OK, lovely.
OK.
Do I need
Thanks
to
so
sign
much.
it and that?
No, you just take it into the pharmacy. You don't pay because you're on benefits anyway, so...
No, that's what I mean. I've got to
Okay.
tick the box and
Thank
sign
you.
at the back, haven't I?
Yeah.
Right, thank you.
Now, Ken, you're here for your diabetic bloods, yeah?
Yep.
How are you feeling today, all right?
Yeah, not too bad. Yeah.
The sun's out today.
That's what they say, sunshine on the righteous, don't they?
Exactly, they do. Don't know what happens all the other days in Bristol, but there you go. What are you doing today? Anything else?
I'm up at the hospital because I'm a voluntary driver out there.
Oh, OK.
That's Southmead.
What, one of those drivers in the little mini golf things?
No. I've been driving for mental health and North Bristol for 26 years.
Wow.
You know.
So do you drive the patients home and
I
stuff?
drive them home, and also with mental health we used to have loads of groups outside. But of course with cuts, all those things are gone.
Yeah. So you've been volunteering for that whole time, have you?
Yeah.
Oh, right. Don't they have a cut-off date as well as an age? I'm sure somebody come in and said they had to stop because of their
they
age.
say they're in their 80s. You know, as long as you can walk.
OK, then, that's you finished.
Right, so...
All right, then,
Okay.
take care.
Bye.
Bye now.
All right, Mr Newton?
Yeah, thank you very much.
OK.
Come on.
Bye-bye.
Bye.
Right, yes, all right, well, thank you for looking.
No problem. All right, take care. All right, bye.